Hi, welcome to today's Health Focus. My name is Michelle Butterfield, and I am the Health Education Specialist at the Southeastern District Health Department here in Pocatello. And I'm here along with Darren Letzering, who is the All Hazards Planner. And we are here to talk about month's worth of exercises that we held in July, and to go over some things that we did with our surrounding counties. And we are just going to go through some slides and just talk about what we did, and I'll turn some time over to Darren.
Thank you. What we did in July was a month-long series of events focusing on a pandemic flu scenario, and we'll change slides here. What is a pandemic flu? You might have heard about bird flu or avian flu. That's happening currently in Southeast Asia, and if people get sick from the flu that they acquire from close contact with the birds, and ultimately it's a flu similar to what we have during the annual influenza season, but it's a different strain that there's very little natural immunity to, so 60% or roughly that number of the people who get sick with that flu actually die. The fear is that it's not if but when this current influenza virus that's in Southeast Asia mutates to something else that rapidly spreads from human to human, and then it'll spread across the world very, very quickly, and ultimately here into Southeast Asia and get everybody sick. So with that is why we're preparing now.
Southeast Idaho.
Southeast Idaho.
It'll come to Southeast Idaho.
Yes.
Okay.
Ultimately. Yeah. What did I say?
You said Southeast Asia.
Oh, yeah. Southeast Idaho ultimately will get sick.
That's what will cause the pandemic when it's affecting large amounts of people.
Yes.
Okay.
So we're preparing now, getting ahead of the game a little bit on what to do for alternate care sites to let overflow for hospitals, because it'll cause about 30% of the people to get sick all at once, and that the hospitals can't handle that. So a focus area of this exercise was to open up facilities or go walk through on what equipment needs to be there, what supplies need to be there, and what kind of staff you need. So,
and an alternate care site for the public is?
That's that overflow location instead of going to the hospital. Ultimately, in a pandemic flu, we want you to stay home, but if you can't stay home for whatever reason, there's nobody there to take care of you, then we want you to go to the alternate care site, not the hospital, because the hospital still has car wrecks.
They're going to be still dealing with day-to-day situations that they do on a normal basis. So, okay.
So we had basically a three-phase exercise that went through the month of July. Phase 1 was the 1st through the 15th of July. And that was a public education campaign where we wanted to get out there and tell the public about pandemic flu and why they should be prepared for it. It's one of our grant requirements to tell everybody, and it's an outreach program, really, what that was. Highlight of that was we went to the Pocatello Chamber of Commerce and talked to a lot of the businesses for their continuity of operations planning. Then the 14th through the 29th, we ran a blog exercise on the Internet, and a blog is a web log that's on the Internet, and each day we posted an update to the scenario. And there were 3 mock news clips that were really the focus of it that we released every 3 or 4 days. And they were mock news clips that you would basically see if you watched the news in the morning that said, the first one was, hey, there's pandemic flu in Southeast Asia. Then the second one said, there's pandemic flu in America on the coasts. And then the third one was, there's pandemic flu everywhere, and it's impacting everybody by supply chain disruptions, such as no gas at the gas stations, no food in the grocery stores, no money in the ATMs. Mm-hmm. It went through a lot of the different impacts that would be. Then phase 3 was the last 2 days of July, where we had alternate care sites. Various counties went through and set those up. We had EOC training, Emergency Operations Center training at the health district, because we're kind of new at that, and we have to be able to run the Emergency Operations Center. And we had communications checks throughout the district. We used different radio communications, satellite phones. We tried those out. Our contract ended up being bad, so we found out something there before we need to know it, and internet and email communications.
And what counties involved?
For this one, we had Bear Lake County, Franklin County did 100% established with equipment and a walkthrough and then a floor plan. So they did the whole thing. Power County did a walkthrough where they basically said we would have 15 cots here, and this is where the doctor would be, and this is where the showers are, and all that. Bannock County did something very similar to that also, but on July 25th. So they were, because of scheduling for the gym that they had to use, they did it early. Fort Hall also participated. They did a tabletop exercise where the alternate care site leader talked through with all the nurses about how they would operate it. About 2 weeks before the exercise, we went through and conducted the walkthrough and looked at how many cots there are for people to sleep, where the nurses stationed at, what are the phone capabilities, and everything like that. So that's a rundown of what we did. For Exercise Foundation, this is a planning piece where we started probably 8 or 10 months ago, and really the ideas popped up probably 12 or 14 months ago, and what's the large-scale exercise we want to do, because we've tried to do one every other year. Our previous one was June of 2006, where we did the Strategic National Stockpile and the points of dispensing for prophylaxis in all of the counties. And that was a really big deal, and that was the last time I was down here talking about that exercise. This time I'm here talking about pandemic flu. But it was 12, 14 months ago where we put the big pieces together, and the objectives are the big pieces. We're priority target capabilities and grant requirements. Each year we figure out what the grant requirements are. We get told those by the state and CDC. And target capabilities are a list of Homeland Security items that we're supposed to be able to do for their capabilities that are required for response to disasters. Exercise regional, district, county, and hospital emergency plans. Most of those are already written. The hospital emergency plans, some of those already include alternate care sites, but this was really a starting point for alternate care sites. Normally you have a plan and then you exercise it, but we started out with the walkthrough so we can start building our alternate care site plans. Exercise coordination methods, mostly that is communications where we need to talk to each other via radio or telephone or satellite phones to make sure we know what is going on in each of the counties, so that we can take requests and then supply the resources that the counties are requesting. Enhance interagency, interstate interactions. What that means is we're trying to build relationships before we need them. And we had evaluators from Wyoming and Utah go to their neighboring counties. So an evaluator from public health helped us out. He went up to Preston, and he lives in Logan, so they're neighboring counties there. And a lady from Afton, Wyoming, went to Montpelier to evaluate them, and she is a public health expert, and they would possibly work together in a disaster anyway. So they're building those relationships before they need them.
Good.
I mentioned target capabilities before. It's a Homeland Security thing where there's a list of 37 tasks, large-scale tasks that you have to be able to do, and these are, I think it's 8 of them that we chose that we wanted to exercise, and it was communications, EOS, Emergency Operations Center management, fatality management. That one's important because we've never really sat down and talked with the funerary industry about mass fatalities in a pandemic, and we actually got to do that one.
On July 17th, yep.
Yeah, that was an important one. Medical surge is a very large-scale capability that involves a lot of different things. As we go through what we did, you'll see why that is. Volunteer and donations management. If you go back to Katrina, the volunteer management was chaos. Sometimes they cause more problems than they solve, so we want to be ahead of the game on that also. Medical supplies management and distribution includes how do you get those resources you need when they're in short supply. Epidemiological surveillance and investigation, that's the disease trackers, really. We put some inputs into the blog exercise so that they could see the disease coming, the pandemic flu, and they'd have to track it and give recommendations. And then most important of this whole exercise was community preparedness and participation.